Today is all on the pinched nerve. Oh my gosh, doc, I think I've pinched a nerve. I have heard that so many times in practice over 23 years. Let's simplify. So, have you ever had this happen where you twist your neck and you get it can be a very, very sharp pain. You can't move your neck. You have numbness, pins and needles maybe shooting down the arm, maybe into the hands. If you move your neck, it hurts so much. When you reposition, it hurts. Have you ever had that happen? And I'm sure you think, oh my gosh, I've pinched my nerve. When we look at the anatomy, nerves don't usually get pinched. Nerves come out of the vertebrae come together and the nerves come out in the holes. What can happen is things can get inflamed, irritated, compressed in that area, and it sure feels like I have pinched a nerve. It doesn't really happen. When we backtrack and we understand movement, alignment, damage over time, these are the three concepts. Let's talk alignment. When things are aligned, everything is moving. When things move, the brain gets information to perceive pain, process pain, send the body information about what's going on in pain, and identify how can I move my body safely. Well, when the spine doesn't move, those things don't happen. So movement and alignment go together. Damage over time. These can go from bad to worse very, very quickly, because if movement and alignment are a problem for years of time, that area can get irritated, compressed, inflamed, and that nerve, remember those nerves, they carry information about function of the body and about different sensations. So this is why a pinched nerve we can feel it. So the symptoms that we have with that can be very different, from numbness to tingling to pain to shooting down. It just depends on the part of the nerve that's affected and the role of that nerve. So your next step is find a chiropractor within Massage Addict, get a full and complete consultation and exam and treatment. They will be able to identify if, again, a pinched nerve really doesn't happen. There are very, very few cases where it actually does get compressed with bulging discs, but this is a very, very, very small percentage. It is just the nomenclature that we're used to. I have a pinched nerve. So a chiropractor is going to be the expert in this area. Consultation, exam, diagnosis, and laying you out a treatment plan.